Hello. Good evening, fellow friends and loved ones. Yes, once again, it's a very great privilege and honor to come to your homes as we continue our discussion on various health topics, various health conditions. Yes, previous weeks we had interesting topics to talk about, and I'm sure today is not an exception either as we journey in our new topic. Yes, I'm very grateful to come to your home. So today is the 11th of April 2021, and it's a very humble privilege. Okay, so we thank God for this day. We begin this presentation in the name of the Father and of the Son and the Holy Spirit. Okay, so um this presentation's outline is the definition of the condition, the risk factors, the causes, the epidemiology, that is, the statistics that pertain this condition, the characteristics of the clinical presentation, the diagnostics tools, that's how we can diagnose this condition, the medications, the medical management, the physical therapy or the physiotherapy management, and then likely surgical management of this condition, then the differential diagnosis, and then a case study of what has been done concerning this condition among hockey players, yes, and then other researches that have been carried out. Okay, so without much ado, I saw a quote somewhere which I want to share before we begin this presentation. Yes, so the quote was that a child's life is like a piece of paper that everyone has um, 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 a portion to write his life on. So, in fact, you should note that all of us here we have infections in the bone, and so scientists have come together to bring some words together to give a name to it. And so osteomyelitis, osteo means bone. So anytime you hear osteoporosis, osteopenia, osteochondral, it means something that relates to the bone, osteo, in bone. And myelitis is just an infection of the bone. Myelitis is an infection of the bone. So osteomyelitis means infection of the bone or bone infection, as our topic for this evening's presentation is about. Okay, so without much ado, let's zoom into the nitty-gritties of this condition. Okay, so osteomyelitis, actually we have two types. We have the acute osteomyelitis and we have the chronic osteomyelitis. Anytime you hear something called acute, it means it's a sudden something within 0 to 3 weeks or sometimes lesser. So you define a condition to be acute when it's within this frame, and then when it's chronic, it means it could be 6 weeks or more, or probably 3 months, or even years. So we say that a condition is chronic when it lasts for quite a longer time and is still persistent, that is still present in the person. Okay, so osteomyelitis actually, as the topic presented, a bone infection or infection in the bones. We mentioned that we have the acute and the chronic type. So osteomyelitis is a process involving the bone and its structures secondary to infection. So we should know that this condition is not on its own. It's actually a result of something, that is an infection in the body, which gets overboard and then causes it to be transferred into the bones, and the bones get infected. So we're talking about some condition that when we get, they can be transferred into the bone and cause the bone to be infected, and then we have something we call osteomyelitis. Okay, so we have some organisms that we call pyogenic organisms. Yes, and these organisms, their examples are bacteria. We have Staphylococcus aureus, that is the one that causes balls under your armpit. Yes, so we have other fungi, and then myobacteria. These are some organisms that when they are transferred from the body into the bone, they could cause infection to the bone, and then you could have osteomyelitis. So we mentioned chronic and acute osteomyelitis as the types of osteomyelitis. That is infection in the bone. Anytime you hear osteomyelitis, it's not a big word. It's just infection in the bone or bone infection. So actually, acute osteomyelitis is a clinical term for a new infection in the bone that can develop into a chronic type, and when the intervention is not delayed. So actually we have one major type called acute osteomyelitis. That is when the body is infected with a condition, it moves into the bone and causes the bone to be infected. The first few days, the first few hours, we call it osteomyelitis. But then when intervention is not carried out, we don't treat the condition in the bone early, it could become worsened and cause that is chronic osteomyelitis. That is the advanced form of the acute osteomyelitis. Okay, so in the olden times, there was nothing like antibiotics. When you say antibiotics, they are medications that helps to prevent what infections. Yes, and so if you have probably an infection in your body, we give you antibiotics to go to fight this bacteria and then other structures. But then in the olden times, there was nothing like that. So people used to, that is the olden times, there were surgeons who used to carry out surgery on the bones to be able to remove these infections, and sometimes the survival rate is very very low, and so this brought out scientists to think about how to be able to modify some structures or some drugs to be able to kill this bacteria or kill this fungi, to kill this microbacteria. And so this brought someone called the penicillin. Yes, a scientist called penicillin, and he discovered a drug that was able to kill these organisms, this bacteria, and then these other structures, and then he called them antibiotics. So when doctors prescribe them for you, if you have infection in the bone, as early as possible, when you take this medication, they are able to control the infection and then take the infection away. But when you delay, then that's where you can have chronic osteomyelitis, and this could be very very disastrous. So anytime you have we're talking about some clinical presentation, some signs that you see that will help you to see that, oh, probably you have infection in the bone, then you can report to the medical doctor or the medical practitioner as early as possible. Okay, so I mentioned that in the olden days, they used to carry out surgical intervention, that's operation, to be able to take out this infection. But then as time went on, they developed medication, they developed drugs to be able to kill these organisms. Yes, some of the surgical procedures that they used to do was extensive debridement. That is, they creep off the infectious area, so that they take all of, if it's the muscle or the skin, they take all off, so that the organism is not able to spread to other parts of the body, which could cause so many disastrous effects. And then we had also socialization, we had wound packing. These are all medical terms that in the olden times the surgeons used to do to be able to reduce infection rate in a person. Okay, so actually the availability of this medication, that's the antibiotics, that actually reduce the mortality rate, that the rate at which people die. So they realized that yes, they had to produce more antibiotics, and actually has really helped in terms of infections across the world. If it wasn't for antibiotics, I'm sure that many of the infections that we have wouldn't have been able to survive if we didn't have antibiotics. Okay, so one very stubborn organism is the Staphylococcus aureus, and so when they discovered the antibiotics to go to treat this bacteria, in fact they were really happy, despite that our current situation still see that this bacteria are very very stubborn. They're able to protect themselves, so if the medication is not able to attack them fully and some is left, they're able to develop a level of resistance to be able to fight any antibiotic that comes again, and therefore they become difficult to kill. So then it makes the condition either not treatable or becomes worsened with time. So that's why it's very important that anytime you experience these clinical symptoms that we will be telling you very soon, you report as early as possible so that the best of treatment can be given unto you. So one research stated that about 40% of this bacteria become resistant to medication, that's the antibiotics, with time. So it showed that yes, this bacteria is very stubborn. Yes, it's very very stubborn, and this microorganism is very stubborn. And so we look at some pathophysiology of this condition called bone infection or osteomyelitis. When you say pathophysiology, it means the disease itself and how it functions in the body. So it actually attacks the individual's immune system. Yes, so it means that we have to eat well, we have to eat very good diet, and we have to also make sure that we have enough sleep. We also have to make sure we exercise as best as possible so that our immune systems could be very, 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 very high. And so it's able to attack a weak immune system. And so this condition also, its ability to penetrate the body is one as a result of the type of the organism. If it's a bacteria, it's a fungi, the type could determine how hard or how resistant it will be, and the location of the organism. So if you have something like a virus like cold, yes, that is able to cause rhinitis, that is running nose, because the nose is always open, it's not closed. If someone has cold, the nearest person, if you are just near the person, you can get the cold because it's able to penetrate as best as possible. The nose is always open, so it's one of the stubborn condition, that is running nose. Yes, that people really fight with. Yes. And also depends on the location, as we said, the nose or the ear. If we have sinusitis, it's a condition, or we have tinnitus. Okay, and also the vascularity of the involved bone. So if the bone also is not well vascularized, that is, there's not enough blood in the bone can be infected as best and as early as possible. And that is why we come to exercise and also ensuring that there's movement in the affected body part or in the body part. Okay, so we'll talk about the risk factors. So what are the risk factors to this condition called bone infection or infection in the bones or osteomyelitis? One, the risk factor is smoking. So if you smoke a lot, in fact, there's a science study that smoking also tends to affect the level of strength in the bones, and then it exposes the bone to infection as vulnerable as possible. The bone becomes vulnerable if you smoke a lot. So if you know someone who smokes a lot, tell the person that, then the person is likely to have osteomyelitis, which is very, very disastrous, and the person could die. So you can explain to the person about this condition, osteomyelitis. And also people with chronic health conditions such as diabetes. Diabetes has actually a relation with this condition called osteomyelitis because of the fact that diabetes actually affects the vascular system. So we have a lot of sugar in the blood system, and then the blood vessels also carry blood into the bones. So when you have interruption, that is the extraordinary amount of glucose in the blood, it could also cause the bones to have less amount of nutrients in the bones, and then they begin to compete with the few amounts of nutrients in the body, and then the bone also could be deprived of enough blood, and this could cause exposure of the bone to infection. Also, we could have someone have kidney failure. The person is likely to have osteomyelitis. That is, the person's, because the kidney is not functioning well, any disease, any organism that comes could attack the kidney, and then the kidney is very important in terms of absorbing nutrients and so many things. So if it's affected and the kidney is not functioning well, then you distort the normal function of the kidney, and the kidney could be exposed to infection. And also people who have compromised immune system, such as HIV. I know that the statistics of HIV in the country is not on a high, but then if you have HIV, you are likely to have this condition called osteomyelitis because your immune system is exposed to any organism, any microorganism, and then you could have osteomyelitis. Okay, and also we have people who abuse drugs. Yes, those who like taking drugs anyhow. So if you probably have headache, you just go to the pharmacy, don't take tramadol. If you have running stomach, go and take any medication. You say, oh, I think this medication is good for me. Yes. So it's advised that if you have any complaints, you need to see the appropriate medical practitioner so that you can have the best medication. Because when you abuse drug, you tend to expose the immune system to any condition, and then osteomyelitis is also a condition that you can have. Okay, and also if you have a recent injury, or if you had a surgery that is involving your bones, that's orthopedic surgeon, when the wound is not fully healed and is exposed to the environment, it can be infected, and infected wounds can cause osteomyelitis, that is infection in the bone, and this could lead to other complications. And moreover, if you are also diabetic and you have had a surgery, you need to protect the wound very, very, very well so that it can heal well, because it's very, very critical for you returning back to function as best as possible. Okay, so we will look at some epidemiology, some statistics showing the prevalence of this condition called osteomyelitis. It's shown that from 2 to 12 years, we have more people, that is probably not in this country called Ghana, but outside, it was showing that between the ages of 2 and 12 years, we had more people having osteomyelitis or bone infection. And then also, as they grow older too, because of the immune system that is compromised, that is not so strong, we have low hormonal production. The body is exposed to all microorganisms, so many microorganisms, and because they have chronic health conditions exposed to, and they tend to have this condition called osteomyelitis. And so this is some statistic that was carried out outside, but then inside Africa or in Ghana, we are yet to have a very substantive research to be carried out. Yes, I might not have read it though. Yes, and also people with circulatory disorders such as peripheral vascular disease, that is where we have difficulty or impairment, or we say inconsistent movement of the blood in the vessels. So this could also cause infection in the bone, because the blood is sent into the bone. The bones also need blood to be able to become nourished and strong. Yes, that's why we exercise, and that's why also we have enough rest so that the bones also can become strong. Yes, okay. Also, problems requiring intravenous catheters, that is where we have if someone is not able to pass out urine, or we have something we call catheter, and so if it's inserted into the genital areas, our medical practitioners make sure that they are not dirty, they are not infected before sending it through the passageway. But then in case of the fact that they are infected, this could also cause someone to have infection in the body, and then likely osteomyelitis. And also someone with sickle cell disease. So if you have sickle cell, your sickle cell disease actually is where we have the red blood cells that's in the body looking like a sickle cell. So they are like this, and then they don't allow enough oxygen into the body, and then people with sickle cell actually have poor blood clotting. So their blood, when they get hit, their blood is not able to clot as best as possible, and then they tend to are exposed to so many conditions, and osteomyelitis is also part. We also have a condition we call systemic lupus erythematosus. These are our conditions. I'm sure you've not heard it before, but if you have this condition, you are likely to have osteomyelitis or bone infection, or infection in the bone. And also, very, very important, this point, malnutrition. If you don't eat well, your immune system will become weak. So those who eat gari, and gari and sugar without eating balanced diet. I know taking balanced diet doesn't mean you should go and eat fried rice and chicken, and then sausage, and then salad. Yes, a balanced diet, you can take in kinky and fish, and pepper. Yes, you can take in wache, you can take in rice and stew with some fish, with some small fish, with some egg. Yes, it's a balanced diet. But then if you only eat rice without anything, you are exposing yourself to beriberi, you're exposing yourself to this condition called osteomyelitis, and your bone will not be nourished. Your bone needs a lot of calcium, fish, to be able to become strong, bones to become strong. So therefore, we are encouraged that we should eat very, very well. And also, if we have chronic hypoxia, that is poor amount of oxygen in the body, you have breathing problems, you could have this condition we call osteomyelitis, because the bones also need an amount of blood and oxygen to be able to survive. And also extremes of age, so the young people also are exposed to osteomyelitis because then their immune system is also strong, and when you are so old to the same thing. So the extremes of age have their immune system compromised, they're not so strong, and this helps them to be exposed to this condition called osteomyelitis, or infection of the bone, or bone infection. So how prevalent is this condition? Actually, this condition, this prevalence has decreased throughout the years because there has been consistent education, even as we are doing now, so that we can minimize the occurrence. That is, early recognition of this condition helps to minimize the infection rate of the condition or the organism, because when they notice them early, we can get rid of them as best as possible. Okay, so in fact, hospital rate admission of this condition has reduced, and this has been encouraged. It has been encouraged for us to be able to battle this condition, and in fact get rid of it. Though it looks like we might not be able to get rid of it, but we can be able to manage it to the best of our ability, and then we can lead a normal life. Yeah, that's very important. So when it's noticed within the a research stated that when it's noticed within the hours, that is between 48 hours, we have a very good rate of combating this condition. And but after 48 hours, then the organism is able to lay its strength, that's foundation, and then becomes a bit resistant to this, to medications and other therapy. So a research also carried out between the years 1969 to 2009 stated that yes, people who are 40 years and above tend to have this condition called osteomyelitis, and also as they grow old, or as they grow older to about 60 years and above, this condition increase, that is 3 times the likelihood of a person having this condition. And this was a cause for alarm. And so as time went on, they found out that yes, they had to take a keen interest in terms of treating this condition. And also this condition was more related to diabetes. So people who had diabetes were likely or more likely to have this condition called infection of bone, or osteomyelitis. And then the statistics say that about 2.3 out of 100,000 cases had this condition within the year 1969 and 1979. And then yes, in the year 2000 2009, about 7.6, that is about 8 cases out of 100,000 people had this condition called osteomyelitis. So as the year went by, the more recording of cases of osteomyelitis, it could be not because there was actually an increase, but then it was more because there was early reporting of the cases and early recognition and early treatment of the condition. And so there was actually good prognosis and then good treatment in those recorded years. And so this condition, this organism called the Staphylococcus aureus, is one boss of this condition called osteomyelitis. So when you have Staphylococcus aureus, about a research stated that about 44% of people who have this organism in their system tend to have the bone infection or osteomyelitis when they are not treated very, very effectively. And also another research stated that children, the amount of children who had osteomyelitis in the year 1970 increased from about decreased from 87 to 47 out of 10,000 of people who had this condition, osteomyelitis. That indicated that there was quite an improved level of treatment and level of education in terms of having this condition. And so we had, apart from the diabetes related osteomyelitis, we also have a type called the vertebral osteomyelitis, and then this actually affects the back. So we have infection of the back. So there are so many conditions that if you have probably had a surgery at your back and then it's not healed well, this could be infected, and this could result in something we call vertebral osteomyelitis. That's when you have the bones being infected. Okay, so and this type of osteomyelitis, that's the bone infection, actually had the prevalence of about 2.4 out of 100,000 people. And actually, as time went on, also there was also an increasing rate of infection that is recorded for the vertebral osteomyelitis. So it moved from 2.4 out of 100,000 people to about 6.5 out of 100,000 people. And then the ages actually were the first, that is the 2.4, were about